You're watching The Wellness Herald, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you've been diagnosed with low thyroid or hypothyroidism. And especially if you are taking thyroid medication right now and still not getting the results you want. With us, we have an expert on the topic, Dr. Berns. Dr. Berns, welcome to the program.
Thanks for having us.
All right, now before we get into today's topic, you have a fairly large practice where you focus on three things. Tell me a little bit about that.
Sure. We have an integrated medical center, whereas in our clinic we take a multi-pronged approach. We have physicians of many different backgrounds along with allied health professionals.
So you have a medical doctor on staff? Okay.
Yes. And what our center is really known for is three different conditions. Type 2 diabetes, hypothyroidism or low thyroid, and then peripheral neuropathy.
Okay. Who is the typical patient? And by the way, we should mention, your father was a doctor, your wife's a doctor.
Yep.
So you've been in and around this, thinking about this for years then. You've always been involved in integrative health or
really my whole
prevention?
life. Yeah.
Okay, good. So let's begin though with low thyroid. And by the way, for a working definition, low thyroid, hypothyroidism is the same thing?
Correct.
Is that right?
That is correct.
So let's begin with who's the typical patient that comes to see you?
Our most typical patient is going to be a female in the 35 to 55 age group. These are women who are suffering from all the typical thyroid symptoms, and what they're seeing is that they're just not getting results with typical treatment.
So what are then the symptoms of low thyroid? What are they?
Randy, there's really a laundry list of symptoms that go along with this condition, but the most common ones we're going to see are going to be things like fatigue. Can't get through the day without a nap. Just chronically tired. Just no matter how long they sleep, they just feel like they could always go back to bed.
Is this what they say when they come in?
This is exactly what they tell us.
Okay.
Yeah.
Okay.
As soon as they sit down after work, they're falling asleep. They find themselves falling asleep midday. They sleep 12 hours and they get out of bed and they feel like they could go right back to sleep.
Is that right? Okay, so some of the other symptoms.
Another big one is going to be weight gain and the inability to lose weight. So, no matter following a low-calorie diet, exercising, modifying their lifestyle, trying all the different fad diets out there. Just nothing is working for these women, like it may be working for their friends or other people that they know, and they can't lose weight like the way that they used to. Other symptoms are going to be things like dry skin, dry coarse hair, losing their hair, losing the lateral third of their eyebrow.
Is that right? So the outside, we talked on the telephone, and I have a little bit of that going on. Is it more women, more men?
It affects the women much more.
Really?
It does affect men, but we see it just so much more in the female population than we do in the male population.
All right, okay, so you were telling me the symptoms.
Sure. Headaches. You're going to brain fog is a big one.
Is that
memory,
right?
Yes, memory loss. They're in the middle of the sentence, can't finish the sentence, don't remember what they were going to say.
And this is all science-based, by the way. I mean, this is in the literature that low thyroid is connected to what you're saying.
Oh, sure. You pick up any book on this topic, and you're going to see all these symptoms.
Okay.
Aches and pains. Feeling stiff in the morning, feeling like they can't get going, feeling older than what they are. That's what a lot of women are telling me. They say, I feel like I'm 20 years older than what I am. Other things are going to be, agitation, depression. A big one is going to be decreased sex drive as well. It just really starts to affect every facet of their life. And, because the thyroid is such a complex organ, it affects so many different things. These women just feel like they're falling apart at the seams because they have this laundry list of symptoms, and it's just not getting addressed in the typical treatment.
Now, cold hands and feet.
Cold hands and feet is another one.
Is that like because I guess thyroid, I have limited research on thyroid, by the way.
Sure.
But controls the body temperature. And so cold hands and feet, is that almost every single time a thyroid problem?
Yep, cold hands and feet is a big one. Low body temperature, sensitivity to cold, whereas someone may feel comfortable in a room, the thyroid patient's going to think that it's freezing in there. These things are very, very common.
And you see reversals, though. This is interesting to me. But you see reversals in these symptoms.
Oh yeah, absolutely.
Like every week, every day in your practice. It's very interesting. So what are some others to help define what this is?
Additional symptoms is going to be dry, scaly skin, changes in the nails, which is very important to women. Having pretty hair, pretty nails. They see dry, cracked nails that break easily, hair that no matter how much they condition it, it stays dry and coarse. Thinning of the hair is a big one. As well as the body aches and pains, the memory fog. Another big one that we haven't talked about yet is going to be constipation and bowel issues, digestive issues. That's a hallmark with this condition. I mean, almost every woman I see is suffering with those things.
Constipation because of the thyroid. So you know, I've had somebody describe it, trying to help me understand, like the idle in a car. Is that close or off, in your opinion?
Yeah, really
the thyroid.
Yeah, really the thyroid really kind of sets the tone or the speed for the body, if you will. It's responsible for the metabolism. It's you know, for lack of a better word, kind of like the engine.
Okay.
You know, it's really going to set the tone for how that person feels and functions that day.
Okay, now your program, and when I hear that you have a thyroid program, I'm thinking you're giving thyroid medication, but your patient base are people that are already taking thyroid. Elaborate on that.
Yeah, most of them are already taking thyroid, because the typical patient that we're seeing is, you know, they've been diagnosed with hypothyroidism. They started to have all those symptoms.
Okay.
They went in and saw their primary care doctor. You know, they got a general thyroid workup done. Medical doctor said, "Yep, absolutely. You have hypothyroidism. Let's get you started on a fix for that," which is typically always synthetic thyroid hormones. So it's going to be Synthroid, levothyroxine, these types of drugs. Okay. So they start on these drugs, you know, and these women, you know, they feel good when they leave that visit because they feel like they have an answer.
All right.
So they feel like, okay, I was in tune with my body, I knew something was wrong, and sure enough, something's wrong, and I have the fix for it. So for a large percentage of these women, though, the synthetic thyroid hormone doesn't work, and they find themselves following the advice of their doctor, and their symptoms just aren't changing.
So when they get the lab work, though, on the follow-up.
Right, so they go back in a couple months later for a follow-up visit, and oftentimes their lab ranges change, and they're moving back towards normal, or maybe they're already normal, and the doctor is saying, bingo, we hit it, you know, everything's moving in the right direction, this is under control, this is what the problem was. But the woman is sitting there saying, but doc, I still have all these problems. My hands are still cold, my hair is still dry, I still have no energy, I still have no sex drive, I still have problems going to the bathroom, you know.
So then what?
And typically they get told, well, usually it takes a little while to kick in, or keep taking it, you know, it's going to get better. The labs are moving in the right direction. So, you know, just keep following this. We'll follow up in a couple of months.
Are some given maybe an antidepressant?
You know, it gets to that point.
I know you want to be positive and you don't want to badmouth mainstream medicine because you align with these doctors.
Of course.
Okay.
Right. So oftentimes what happens is, you know, over time they start going in with the same symptoms over and over again, and especially when their labs are back in the normal range.
Okay.
Then they start getting diagnosed with things like bipolar disorder. They get told that it's all in their head, fibromyalgia. So then now they're on, you know, pain medication.
Do they tell you that, though, by the way, that they were told it was all in their head?
Oh, absolutely.
That there's, really?
Yes. Many of our patients have been told that I've been everywhere, and everywhere says that there's nothing wrong with me.
Okay.
And that's extremely frustrating.
So how do you look at it differently than, let's say, a traditional medicine?
Sure.
And by the way, what do you guys call yourself? Integrative?
Yeah, we're an integrative healthcare center. So that meaning, you know, we have doctors of several different backgrounds. So, you know, we take a multi-pronged approach to this. So we're able to use the tools of traditional medicine because we have, you know, medical physicians on staff. So then we're also able to use other tools, you know, complementary and alternative medicine, nutritional therapy, supplementation. You know, we're able to run tests that are outside of the standard of care that really give us a clearer picture as to what's going on.
Now, I went to your website and I've talked to you guys a little bit about this, and you said that in your practice, these people that are taking thyroid medication and still have the same symptoms, cold feet, can't lose weight the way they used to, etc., that they have Hashimoto's. Am I pronouncing right? Hashimotos disease.
Correct.
So elaborate on that.
Right. So the vast majority of the women that we see in our clinic, and you know, even the literature out there is saying that the number one cause for hypothyroid symptoms is typically an ignored or misdiagnosed case of Hashimotos thyroiditis. And what that is, Randy, is that's actually an immune system condition. It's actually not a thyroid problem at all. It's actually an autoimmune disease that attacks the thyroid that sits right down here in the neck. So interesting that's being missed. I mean, knowing that you were coming on the program today, I Googled Hashimoto's, and I think anybody watching this that's on thyroid should Google it. Absolutely. Because
it's clearly defined, by the way, in hundreds and hundreds of articles.
Oh yeah, this is not a new disease or condition. It's been around for 100 years.
Autoimmune.
Yes, yes, it's actually an autoimmune condition. And what an autoimmune disease is essentially your immune system recognizes part of your body as a foreign invader. So just like it would a flu virus or a bacteria, the immune system is going to make antibodies that are going to go and attack and destroy that, right? So in an autoimmune disease, what happens is it looks at the body's own tissue as a foreign thing, and it goes and attacks and destroys that. And what Hashimoto's is, clearly defined, is it's an autoimmune disease against the thyroid. So essentially,
but that's not like a sentence for, I mean, this is also something like your type 2 diabetes program where it can be reversed.
Oh, absolutely.
Is that right?
It can be really put into remission.
Okay.
Okay. So all autoimmune diseases tend to have a permanent, they're a permanent fixture in the person's life. The way that it affects the person, though, that's the key difference. Because if the patient continues to go through life treating it as if it's a thyroid condition, completely ignoring the immune component to it, they're never going to get better, and they're going to continue to spiral out of control. What we do find, though, is once we do discover what the immune triggers are for that patient.
What does that mean, immune triggers?
Sure. So immune triggers are going to be things for that patient that it's going to spark the immune system into action. It's going to cause the immune system to flare up and take action towards something. And then when that immune system does that, right, not only is it going to take action against whatever that trigger is, it's also going to then also increase the antibodies that it's making against the thyroid, which is then going to continue to destroy that thyroid.
So it suppresses the thyroid.
It doesn't suppress the thyroid. What it does is it attacks the thyroid.
Okay.
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 So
when you take care of this underlying problem, you say you like to go to the underlying cause.
Right.
Do you see that when they retest? I mean, what's changing though? Just that the thyroid becomes healthier?
Sure.
It works better?
No, it's not that. It's that the immune system becomes healthier and starts to work better.
And then the constipation goes away.
The constipation goes away, the dry skin goes away, the hair becomes thick and lustrous again, the nails become hard and strong again, the energy comes back to normal, pounds start falling off.
Are people skeptical, by the way, when they hear this? And what are the frequently asked questions? Okay, so if somebody's on thyroid medication, they probably know a thing or two about thyroid.
Sure, about
so when
thyroid.
they come in, what do they want to know about this? Okay. About this Hashimoto's? Is it news to them?
A lot of times it is news to them. I'd say in a large, well over half the cases that we see, it is news to them. There are some patients that do come in that, they know about it, maybe they've even been diagnosed with it, but they've never gotten any treatment or any advice as to how to handle that component of their condition. So the big things that patients want to know is, why do I still have these symptoms? Okay, why am I still, even though my lab ranges are normal, okay, how come I still feel exactly the way I did before I started taking the medication? The other thing that they want to know is how come this hasn't been addressed already?
Yeah.
Right?
What do you tell them when they say that? And you smile when I say that. I guess this is a touchy one, right?
A little bit, because with Hashimoto's, unfortunately, there is no perfect method of treatment in the standard of care.
But there's a biological marker for Hashimoto's?
Oh, absolutely.
So there's a test.
Yes. It's clearly defined. It's readily available.
Most practitioners don't run these tests?
Most practitioners don't run the test because, unfortunately, they don't have the tools in the toolbox to be able to effectively treat it.
Meaning what?
Meaning that
the nutritional component?
Meaning there's no clearly defined prescription medication to treat this particular disease. Okay. Because, again, it is an immune system disease. It is not actually an organ or thyroid condition. Okay. So what happens is the immune system is destroying that thyroid.
And the experts, I mean, I'm not a medical expert, but medical experts couldn't disagree with this component to what you're saying?
Oh, no, this is
Hashimoto, really?
No, it's irrefutable.
Okay.
Hashimoto's, it's well known in the medical community. It's just not actively
But you have
treated.
to have a lot of time. I mean, you guys have the luxury of time. I mean,
Again, that's just it. Okay, in traditional healthcare, right, there isn't the time and the resources that are needed to dedicate to effectively treating this. That's a big thing that makes our center different, Randy. Is that we limit how many patients we see so that we can deliver amazing care and really get patients the results. Because all of our treatments, Randy, are individualized to the patient. We have no cookie cutter approach. If we have 100 thyroid Hashimoto's patients, 90+ of them.
So if you had 10 charts, 10 blood works right here, everybody's going to get a different protocol?
Absolutely. So all the cases are different because there are so many different triggers. For instance, one patient, they may have a lot of food insensitivities or allergies. Okay. Another patient may be suffering from vitamin or mineral deficiency. Another patient may have adrenal fatigue or adrenal exhaustion. Another patient may have leaky gut syndrome or really serious problems in the digestive tract. Another patient may have heavy metal toxicity, and the list goes on and on.
So people come to you at different, stages of damage.
Yes.
Of how sick they can be.
Absolutely.
And but you are, so the results. Mm-hmm. The results are there?
The results are there, and the results are impressive.
One of your founders, I talked to him, I think Dr. Ott, he said, I said, what do you want to be known for? And he said, results, without hesitation. Do you think personally that you guys have about a comprehensive approach to hypothyroidism or Hashimoto's disease? It's out there.
It's the most comprehensive I've seen.
That you've seen, okay.
Yeah, and the results really speak for themselves.
And people travel, I guess, to see you sometimes.
Oh, absolutely. Yeah, we have it's not uncommon for patients to drive 2 to 3 hours one way.
In Tampa, your Tampa center, and you have centers stretched out.
Yeah, we have centers throughout the United States. Unfortunately, we just don't have enough to fill the need. So, in our area in Florida, we have patients, traveling the entire west coast of Florida to Tampa to see us.
So this is, in a way, this is your specialty there, is thyroid. Because people always ask us, who does this and who does that? How do people find out about you? Because, there's a lot of people wanting to know, who to go to,
sure,
and things like that. So you do some ads, things like that, shows like this.
We do, but the vast majority of our patients come from referrals from other patients that have had a lot of success in our program.
Like a word of mouth.
It is mostly word of mouth.
People need to know, this is a real interview. I'm not endorsing you today. I don't know enough about your program at all to endorse you, but it does sound interesting. But I like the fact that it's results. So you make statements to me on the phone like, Randy, it's life-changing for some people.
It is. It is. I have patients, I have patients who come into me literally falling apart at the seams. And they're there with their husband.
Like what? What does that mean, falling apart?
They can't function in life, many of these people. Okay? They can't get through the day. The fatigue has overcome their life. The memory fog gets so bad.
Memory fog, really? Okay.
Sure, great example. Patient that I just treated recently. Okay? She was actually a nurse. All right? So, being a nurse, on her feet all the time, all right? Having to do a lot of activity, constantly moving, having to remember a lot of different things in patients' charts, medications, all these types of things. It got to the point for her that it was so bad that she was starting to forget what to do with the patients. So she actually had to stop working for a short time, okay? And a very young, she was in her late 40s.
Okay.
So had she not gotten the help that she needed, she wouldn't have been able to work in the career that she loved for the next 20 years.
So that's typical, though. 48-year-old woman. She's everybody. She's a lot of people, right? So with her, and you say, so how soon before she started feeling better?
3 weeks in that particular case.
So what'd you have to do? Could you give me kind of a...
Sure. In her particular case, a big thing was she had food sensitivities that were really they were huge immune triggers for her. So it's first thing,
like food allergy kind of things is what we're talking about?
Kind of, not necessarily allergies, but sensitivities, which the immune system is going to see those as similar processes.
Okay.
All right. So with her, what we did, cleaning up her nutrition. What we did, we put her on a digestive repair protocol, all right? And after just a couple of weeks, she started to see huge improvements, especially in her energy. After about 30 days, she started to notice that the pounds were falling off, all right? But the biggest thing that she remembered was the clarity for her, okay? So she was able to remember things again, not have to write things down in 3 different places.
You say they really do. They carry things and have to write everything down.
Oh, yes. Yeah. Many of them are obsessive about it. They'll have, reminders in their phone as well as in a planner, as well as written on the fridge at home, because they need to be able to remember to do these things.
Okay, so with her, she had Hashimoto's.
Had Hashimoto's.
You went to the underlying cause, right? Rather than just treating the thyroid.
Exactly.
I'm not putting words in your mouth, I hope, here.
No, not at all.
I just want to make sure I have this correctly. And so with her, nutrition. What other testing do you do, by the way?
Okay. Well, again, on a case-by-case basis, we're going to do an elaborate blood workup on these patients, much more so than what they typically get done at their primary care provider in most cases.
Okay.
The other thing is going to be really looking at the hormones as well as the adrenal function. That is key. Adrenal exhaustion.
So you're going to check all the hormones?
Absolutely, because adrenal imbalances are oftentimes a big trigger in this mechanism. So then you're also going to have to look at the adrenals. Okay, again, that's hormone production. You're going to look at the cortisol rhythms. You're going to look at all those different things. Another thing is you're going to have to do a comprehensive digestive analysis, screening for chronic infections, screening for leaky gut syndrome, making sure that they have the right balance of bacteria in their digestive tract. That's where we absorb all of our nutrients.
Yeah, you say you heal the gut, whatever the heck that means. Right?
Sure. So the digestive tract, right? So where do we absorb all of our
intestines, right?
Absolutely.
Okay.
So where do we absorb all of our nutrients? Digestive tract, right?
Okay.
Where do we absorb all of our medications? Through the digestive tract. So if your digestive process is off and your absorption is not there, you're not going to be getting the nutrients out of your food. You're not going to get the full benefit of your medication because it's not being absorbed. It's passing through.
So the people that are taking thyroid medication, which is your target audience, but it's not working,
right.
This helps that medication work better.
It does. It does.
Okay.
It helps the body as a whole work better because that's what our approach is really all about.
So their memory improves.
Memory improves, skin improves, energy improves, they lose weight.
What's the number one thing that improves first? Energy?
Energy, weight loss, and then the changes in the skin, the hair, the nails. The other big thing that it doesn't get talked about as much as a lot of times their sex drive.
So libido goes up.
The libido returns.
Okay, good. We're going to take a quick break. We come back. I want more about the process, what they can expect on day one. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, what you need to know. You can't miss this next part about the process and if you've been diagnosed with hypothyroidism. We'll be right back. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you have low thyroid. Okay, so Dr. Berns. Yes. Now, and we are out of time. A recap, okay? So your ideal patient that you can help when it comes to hypothyroid is what?
Sure. If you've been diagnosed with hypothyroidism and you're not getting results by taking the medication that's been prescribed to you, if you still can't lose weight even though you're exercising and following a low-calorie diet, if you have chronic fatigue, you have no energy, your hair is still dry, brittle, and falling out, your skin, your nails, they're getting weak, your skin is getting rough, puffiness in the face.
This is a medical program. You have a medical doctor. I mean, you have a team of doctors.
Yes. We have a team of physicians and allied professionals.
You have a lot of employees there, a lot of people that hit this.
Yeah, we do, and that's why we get such great results. Is because we hit these problems from all angles and all aspects. So when patients are, they're having the things that aren't getting addressed. The headaches in the morning, the stiffness, the puffiness in the eyes, the drooping eyelids.
These things go away.
They clear up every day, Randy. Every day.
So if I hung out at your office, I mean, are you ever surprised?
I am surprised oftentimes. Not so much with the results anymore because I've seen it for so long, but oftentimes with how fast it happens. How fast these people really turn the corner. It is. And it makes it so much fun to go to work, and it's just so rewarding because I know how it affects these lives. And when these patients come into us initially, like I said, they're in pieces, Randy. They're really suffering.
So as a recap too, if they missed the first part, that they're currently taking thyroid, they still have symptoms. You're saying it may be misdiagnosed or not caught Hashimotos disease.
In most cases.
Google Hashimotos. I guess the science is there.
Oh, it's
an autoimmune problem.
It's an autoimmune problem.
And you address it that way.
Correct.
And then they start feeling better.
Absolutely.
Interesting. Okay. So, and as a recap, so you're looking at putting them on an anti-inflammatory diet, and it's like a 4 to 6 month program.
In most cases.
They can come in once a week, or they do come in once a week?
Most patients do start off at once a week.
Okay, okay. And then, and some people get better the first week, second week?
Yeah, usually we'll start seeing results in 2 to 3 weeks.
Okay, and so where do they get started? Yeah. What do you say, by the way? Somebody's watching this. Okay, they're taking thyroid.
Right.
Very sophisticated because they're going, I've heard it all before. I think I've tried everything. I've never heard about this Hashimoto's, or maybe I haven't been treated for it. What do you say to them? Where does it begin? Okay.
The best thing for that patient sitting at home with questions is just to pick up the phone and make an appointment to come in, so that we can sit down with them one-on-one, take them through that process. Another great thing, they can go to our website. They can watch story after story after story of people who have had success in our program. And there's one thing for sure, there's too many people on there for them to all be lying, Randy.
Okay, good. All right, I want to thank you so much for coming on the show.
Thanks.
Great information. You've been watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, go to our website. You could put in Tampa. It's Integrative Health.
Integrative Health of
Tampa. You could put in Dr. Berns, or you could just put in thyroid, and we'll have it on our search engine. For now, I wish you good health.